and move through it without having to delay any of our discussion or anything of that nature. So I think we've got a quorum. I'm going to go ahead and call the meeting to order. This is the Silver State Health Insurance Exchange meeting, which has been properly noticed for today, Thursday, August 14th at 1:30. We're video conferencing between here in Henderson and also in our offices in Carson City. I'm going to ask our new executive director, who I've been working with for the last 3 days down here, to take the roll call, and then we will make some announcements and proceed into public comment.
Thank you, Madam Chairman. Madam Chair, Madam Marquez is present.
Yes, you may.
All right,
Thank you.
very good. Okay, Ms. Atkins?
Absent.
Absent. Ms. Johnstone?
Here in Henderson.
Okay. Ms. Lewis? Absent. Dr. Jameson?
Present.
There we go, by phone. Ms. Kerr?
Here in Carson City.
Okay. And Dr. Ford is absent. Mr. Gilliland?
Here in Carson City.
Okay. Commissioner Kipper? Absent. And Ms. Testa?
Here in Carson City.
Good. You have a quorum,
We
Madam
have
Chair.
a quorum. Thank you. Go ahead and make some announcements here today. We are going to pull from the agenda item number 9. Xerox has started to accumulate the information for us for our review. That review is not complete at this point in time. There may be a change in personnel working on this from the Xerox side, and I want to give our staff the opportunity of working with those individuals to make sure that the board has complete information on this area. So we have got started on it, but it's not complete enough to bring back to the board for discussion. Again, I want to welcome our new executive director, Bruce Gilbert. I've had the pleasure of working with him for the last 3 days. We've been visiting with the brokers in Southern Nevada. We've been visiting with navigators and with carriers that are headquartered here in Clark County, and they have been very, very good meetings, and I think it's given Mr. Gilbert the opportunity of knowing some of our important partners and starting to build those relationships with them. So,
Thank
Mr.
you.
Gilbert,
Thank
welcome again, and let's do some announcements on some of your staff before we go into public comment.
Absolutely. I am very pleased to be able to introduce two new staff members that are working with the exchange. The first is Tyler Klimas, who is here. He is our new communications officer and will be working very closely with me in Carson City. He comes to us from the governor's office, and I'm very, very thankful to have you here. The second individual is Nick Cranston, who is in Carson City. He's our new IT analyst and works with Damon Haycock. And there he is. And we anticipate having additional staff additions in the not too distant future.
And I'm sure your executive director's report will help move us through that item. So thank you very much. Let's open it up for public comment. Can I have a showing of hands for public comment in Carson City and in Henderson? Anyone in Carson City?
One in Carson City.
Okay. You want to get started in Carson City, please?
We can't hear you.
Hit the button.
Good afternoon. I'm Kevin Sampson with Health Benefits Associates in Reno and the Northern Nevada Association of Health Underwriter Legislative Chair. I'd like to comment on a couple different items. One is we have major challenges with the applicants that we have presented before Xerox today. And with CJ not here, I'd like to just find out who that we can talk to so that we can complete these applications. I have complete histories on 3 people that have made applications with the exchange and that have not been issued. And I'm just looking for some guidance. One general comment that I have from Xerox and our interaction with Xerox has been that the attitude there is not what it should be, and that we have been told by Xerox that it's probably going to be easier to make application starting on November the 15th and get our applicants today that are eligible for special enrollment period enrollment. They're saying that we should be looking at a January 1st effective date because they're 40 to 50 days behind in their applications. CJ before was the one that would normally take care of these items for us. I have 2 for July 1st and 1 for an August 1st effective date that I would like to have the board's attention on these sheets, and I'd like to leave these behind when I leave.
All right, and forgive me for asking again, could you identify yourself again for the record, please? I
Yes.
didn't write it down.
I am Kevin Sampson with Health Benefits Associates in Reno, Nevada, and I am the Northern Nevada Chair of the Legislative Committee for the Northern Nevada Association of Health Underwriters.
Okay,
Representing
thank you very
brokers in
much.
Nevada.
Ms. Rich, are you there at the table?
I am, and Mr. Sampson, I'll get in touch with you after the meeting today, and I'll give you my contact information. I'll help you.
Great.
All right.
Thank
Ms.
you.
Rich, if I might make a suggestion, please, so that he doesn't have to stay through the whole meeting, which could go 3 or 4 hours. Would you mind excusing yourself from the table and just getting that information and then coming back and joining us for the rest of the meeting, please?
I will do that.
Thank you very much.
Thank you.
How about public comment here in Henderson? No, this is
That's
all
good.
overhead.
Very good.
Okay.
Thank you very much. For the record, my name is Barry Gold. I'm the Director of Government Relations for AARP Nevada. AARP Nevada would like to welcome Mr. Gilbert to the Great Silver State and to the Silver State Health Insurance Exchange, also known as HealthLink. There are great opportunities as well as some challenges, and we are so glad to have you here as well as to have Tyler on board. We'd like to say that please turn to AARP Nevada as a resource for questions, for ideas. AARP has a state office and actually 53 state offices, and they are all involved with their exchange in one form or another, following what's going on. So in terms of getting information on what's been happening in other states, what works and what doesn't, as well as some national policy experts in terms of following what's been going on. So please consider us a resource and reach out to us, as well as for local activities and events that we may be involved in. I'd like to address Item 10, which may become Item 9 now since you dropped 9 off, and that's procuring a marketing vendor. Whoever you choose, whether you choose to keep KPS3 or choose a new one, AARP Nevada strongly encourages the board and the staff to ask them to include the 50-plus population as a target audience. They were not. If you look over their marketing materials and their proposals and their packages, it ended at age 59. So while there might have been some spillover and some people there were a lot of places that you were not. There were a lot of events in other places, to use the words I used last year or earlier this year at this board meeting. I said HealthLink was conspicuously absent at some of those places, so they really should be there. If you look at the demographics of who signed up for qualified health plans, the largest population that signed up were people over the age of 50. And you really didn't do any targeting outreach to them. Imagine how many more may have signed up if they were included. They may not be the biggest target audience, because yes, you want the young invincibles, you want all of them for different reasons, but please include them in the target audience, whoever is there. Thank you very much.
Thank you, Mr. Gold. Is there anyone else here in Henderson? How about in Carson City? Anyone else?
No, Madam Chair.
All right. Thank you very much. Let's move on to the approval of the minutes for July 10th. Has everyone had an opportunity to read through those minutes? And are there any amendments or changes or edits to those minutes?
Madam Chair, this is Leslie Johnstone. I'll move approval.
Thank you. Do we have a second?
I second that. This is Dr. Jameson for the record.
Thank you, Dr. Jameson. All in favor of the motion?
Aye.
Aye.
Any opposed? Thank you very much. The motion carries. Let's go on to the Executive Director's report, which will be your first report.
Thank you, Madam Chairman, members of the board, members of the public, good afternoon. I want to thank everybody for the kind welcome that I've gotten to this point in time. Everybody has been very kind in terms of offering their time and offering suggestions as I've spoken with them, whether speaking with navigator groups or brokers or carriers or any of our other partners throughout the state. And I'm very appreciative of that. My last 2 weeks, honestly, have been kind of a blur. I've had great meetings, whether I was talking to other state agencies or brokers or carriers or navigators. Invariably, we received a positive response and a common commitment to make sure that the exchange flourishes and is ultimately successful going forward. I've provided an executive director's report here, and it's more in the way of remarks than it is anything else. It's a window into my observations as I've come aboard and to give people an understanding of my immediate plans and priorities. And there are a couple of points in there that I think that are very important and are worth review here today. The first is the Gallup Healthways survey, in which there was a survey taken that looked toward the efficacy of exchanges across the nation in reducing the uninsured population for each state. If you take a look at that, you'll see that Nevada actually started out on the wrong side of the equation. We had a 20% uninsured population here. By the end of open enrollment, we had reduced that by 4% to 16%, which doesn't sound great until you take into account the fact that that is 111,000 people who are now insured that were not insured at the beginning of the process. Despite the stumbles, despite the issues, despite the problems, we were able to move 111,000 people of our citizens from being uninsured to having access to health insurance. That's a success story, any way that you slice it. On the other hand, we have consumers who had and continue to have issues with respect to the coverage purchased through the exchange. One thing that I think it is important to make clear is that we, the exchange, and when I say the exchange, it's important to understand we're not a monolith. I have a staff of 8 people, ultimately 12. There are 7 people who sit around this table who take very seriously their obligation to the citizens of this state to provide access to affordable health insurance and care. We understand and we appreciate the human cost that is associated with every single issue that arises. We do not take that for granted. We genuinely want to help, and we are doing our best to help. And we are making progress if you take a look at the overall picture, but the progress being made is simply not enough. And so one of the things that I have said that we are going to do, and that I've indicated in my report that we are going to do, is we will be providing additional resources and increasing our efforts to promptly move forward all open cases toward closure and resolution. It's important that we do that, but it's also important that we not simply focus and look backward. We have an upcoming open enrollment, and we also have to have some of our attention on that as well. Our open enrollment preparations are well underway. We're working closely with all of our strategic partners to make sure that we cross all our I's and dot all our T's, and that the execution is superior this time. And we're going to do all that we can to make it smooth. That said, I think it's important that we understand one another, that there will be bumps in the road. This is not going to be a flawless process. That's simply not possible. We acknowledge that. We understand it. We will work to make it as best as we can. We understand and recognize that we need to be prepared for these issues as they come forward, and we will be. We will make sure that we add staff so that we have adequate staff on hand to facilitate communication and resolution of issues as they arise. This is a very challenging time, but it is also time that's full of opportunity. And we're going to come out of these circumstances, I think, stronger as an exchange, more robust as an exchange, and we will continue to do all that we can to reduce the number of uninsured citizens in this state. And that, Madam Chair, would be the sum and substance of my remarks.
Thank you. Do any of the board members have questions for Mr. Gilbert? Dr. Jamison?
No questions. Thank you, Mr. Gilbert.
Thank you.
Thank you.
Ms. Kerr, any questions from Carson City?
No, thank you.
And our ex officio members, we have Mr. Gilliland and Ms. Teska. Any questions?
No, thank you.
Not at this time, thank you.
Thank you. All right, let's move on to agenda item number 5, which is the supported state-based marketplace transition update. And is that Mr. Haycock?
Thank you, Madam Chair. Damon Haycock for the record. I'm going to give a brief update. I know it's about 7 pages, but we're not going to read it out to everybody. I want to make sure that I just touch the high points. As everyone knows, on May 20th, the board made a decision to move forward with the supported state-based marketplace model, and since then there's been an immense amount of activity, not only at the exchange, but with all of our partners. I want to take a quick moment to highlight those that are participating in this process, because as Director Gilbert mentioned, we are not a monolith, and we are working very diligently with all of our partners and other stakeholders.
Mr. Haycock, can we? Oh, you did? Oh, okay.
Can you turn it up, please?
We can't hear you. We're gonna.
Is this better?
You texted Nick? I did. Oh, okay. Thank you. Try it again.
Is this better?
Oh,
much better. Thank you.
Thank you.
Perfect. So I just wanted to highlight real fast our partners that are participating in this process with us. We have, of course, CMS, our federal partner, and then the Division of Welfare Supportive Services, the Division of Insurance, Enterprise IT Services, our contractors in Atoma, as well as the Deloitte that's assisting with welfare, PCG Consulting, KPS3 in marketing, our carriers, our enrollment facilitators, and our brokers and agents. As part of this SSBM transition, we have certain CMS milestones, and we are providing those updates to CMS every week. We feel very confident, although we are cautious in our approach to meeting those. As far as the status of our transition, carrier onboarding is a high priority for us. Without carriers, we have no exchange. And at this time, most of the carriers have received initial approval and are awaiting CMS to initiate the next phase of testing. So they've already signed up, and they're either waiting for that approval or they've actually begun testing with their plans and with that enrollment process. Also, at the request of the exchange and our carriers, CMS has agreed that they will offer end-to-end testing for our carriers and for the exchange, so which will enable the actual test to go from account creation all the way through the effectuation of enrollment, which is critical in ensuring that we are prepared come November 15th. As you'll see on page 3 and onto page 4, there are some tables that describe some dates that are crucial for this process that we are indeed meeting. Additionally, you'll see there's a color-coded table at the bottom of page 4 where we're highlighting each and every carrier that is participating on the exchange and where they're at in the process of EDI onboarding, that electronic data interchange files, that 834 files you've been hearing about every month, where we transmit data from the feds to the carriers to ensure that those folks get enrolled. Additionally, plan certification is moving forward. There have been 5 qualified health plan binders, or for 5 qualified health plan providers for the individual exchange, and there's 1 that has signed up for the shop. Both Anthem and the co-op have submitted plans for all 4 service areas. So yet again, in 2015, we will have health insurance coverage offered on the exchange for every citizen in Nevada. Additionally, there's multi-state plans that co-op is also providing for those that crest over our border. One of the most exciting parts of this process is we've learned that Time Insurance, a new insurance carrier to the exchange, will be providing PPO plans for both Southern and Northern Nevada, increasing competition and providing more service to Nevada. We've had 158 plans submitted to the Division of Insurance, and 152 of them have been successfully transferred to the federal hub. So we are well on our way to being ready with our carriers on November 15th. As far as the shop, we have had, due to the employee choice decision of the board, there will be one qualified health plan and one standalone plan, or standalone dental plan offering. There's also, the shop will also conduct their own billing, and I was able to participate in a webinar with CMS to find out how that was going to work, and it appears that they have that process well underway to be able to invoice and appropriately aggregate billing for our small businesses. Of course, there's only one carrier, as I mentioned, that is participating on the shop next year, which is the co-op. As far as brokers and agents, we have reached out to brokers and agents, both appointed and not appointed, to provide critical information on registration and training opportunities to be ready to enroll individuals in the individual market and the shop marketplace on the federal hub in November. CMS has issued out multiple webinars, and we have already received reports that brokers and agents have successfully gone through the training and are all ready to sell plans beginning open enrollment. And then for our exchange enrollment facilitators, they too are basically chomping at the bit, waiting for that training to be released, for they need to pass that training and get ready to help Nevadans enroll in November as well. That training is scheduled to come out sometime next month, and once we receive it, we will push it out to each and every one of them. And then finally, Medicaid and Nevada Checkup. There's been an immense amount of building requirements, design, developing the interfaces. The single stream application has been verbally accepted by CMS, that application that they are going to place on Access Nevada. Additionally, the requirements for the welfare call center are being identified and vetted, and that process is being built as we speak. They've designed the pre-screener tool that is going to help Nevadans redirect to the specific location that they need to reduce confusion and to help in customer service. And they're also developing that account transfer process, that two-way process. When an individual goes to healthcare.gov and they should have gone to Medicaid, the healthcare.gov will send that information to welfare and vice versa. So with that, that's my update in a nutshell, and I'd be more than willing to answer any questions at this time.
Do we have any questions for Mr. Haycock?
Madam Chair, this is Leslie Johnstone. Mr. Haycock, can you talk more in depth about the end-to-end testing, when that's going to happen, and who will be involved?
Yes, Ms. Johnstone, Damon Haycock for the record. The end-to-end testing is planned for insurance carriers as well as PCG, our independent verification and validation vendor, as well as the exchange. And we're looking to partner with all three entities so we can ensure that, that as we test an account creation all the way through to the effectuation of enrollment. So try not to get too bogged down in the technology. When an individual signs up through healthcare.gov and they pick a plan and put it in their cart, healthcare.gov will then send a file, an 834 enrollment file, over to the carrier. And the carrier will then, in this end testing, fast forward time as if they had sent a bill to the consumer and received that payment, and will then in turn send back an 834 enrollment file effectuating that enrollment. And we're going to be able to see every step of the way. And it's critical to ensure that we don't have those hiccups that may have plagued us in this last open enrollment. The feds have not developed that process completely, and we are awaiting their announcement that is available and ready. However, we are starting to get our accounts in order to ensure that we're ready to perform that testing when that is made available.
Madam Chair, if I could, this is Leslie Johnstone. On end-to-end testing, I would think it would also include the back and forth with the Division of Welfare Supportive Services and their system. And then if you could comment on that. And then my other thought is it would be, I think, highly advantageous if we would include brokers and facilitators in the testing.
So Damon Haycock for the record. Yes, Ms. Johnstone, there will be end-to-end testing as well scheduled for the welfare and their testing team to not only test the account transfer process, but also to vet the pre-screener and to make sure everything is going in the direction that it's supposed to. The exchange has already partnered with their test team. We've offered up our new IT analyst to participate, and they have graciously accepted. So we're working hand in hand with welfare to ensure that end-to-end testing is completed as you mentioned. As far as brokers, and agents, and navigators go, as we get more information, we would love to have all the assistance that we can to ensure that we have completely tested the system by all types of users. And so we will be reaching out to them as well if the opportunity prevails.
And Madam Chair, if I could follow up on that. On the first part about the end-to-end, including welfare and supportive services, what's the time frame for that testing?
So it's my understanding that the end-to-end testing is one of the CMS milestones that is required to occur, and I believe it needs to be finished by October. And so I'm not 100% sure when it starts, but I believe it starts next month, and I can find out exact dates and get back to you.
As one board member, I'd appreciate that. And then as far as having the brokers, agents, and facilitators in the testing, why is that not a yes or a no kind of approach? Who are you waiting for information from?
Ms. Johnson, we are waiting for just the creation of the end-to-end test environment that CMS has said that they will provide for us. And once we understand how that process can occur, we will understand how many accounts we're allowed or authorized to have. And then we have to go back and forth with negotiating, trying to get more folks on board. Because we're moving to the supported state-based marketplace model, we are losing a lot of control that we have today over how things occur with our eligibility enrollment system to include the test environment. And so we're kind of at their mercy, and we will definitely make that request on behalf of the board and on behalf of the facilitators and brokers and agents. But we can't guarantee that'll happen.
When will you know?
The short answer, when they tell us.
When is the milestone for the testing?
So the milestone is for specifically for the account transfer testing. We asked for an additional end-to-end test process for the exchange. So there is no end-to-end testing requirement that the exchange performs because CMS controls the eligibility and enrollment system. So we've asked to be included in that process, and it's asked every week for the last 2 months, and we will continue to ask until we get our answer.
Okay, thank you.
Do we have any other questions from board members or ex officio members for Mr. Haycock? All right, as a follow-up question for you, the EDI registration is taking place right now. When is the boundary testing to take place and the EDI testing to take place? And do those have separate milestones from the end-to-end testing?
Yes, Madam Chair, Damon Haycock for the record. The boundary testing and the EDI testing was to either start this week or next week, pending the approval of the original EDI applications from the carriers. CMS was supposed to reach out to them this week to ensure that they're ready to go, and then test cases were to be delivered and they were to start that testing process. Some of the other carriers have already started preliminary testing, and so we're just trying to catch everyone up at the same time. I hope to have this chart filled out a lot more for you guys next board meeting, but we feel that that's on track and that's due in the next couple weeks.
That's a question.
Oh, and I'm sorry, Madam Chair. Oh.
Go ahead, Mr. Haycock.
I'm sorry, Madam Chair, I didn't answer your next question. How is that different from end to end? It's a component of the end-to-end testing, and so it's only one piece. They're going to do parts of it at one time. They're going to send an 834 file to each carrier and see if they can receive it and process it and absorb that data, and then that carrier has to send what they call a 999 file back, or a receipt file. And they're going to do these separately, and then they're going to continue to increase, and then they'll also do stuff like terminations, qualifying life events, adding a child, what have you. So there'll be separate testing that occurs, but it's all part of one, and then at the end, an end-to-end test needs to happen where you take it from beginning to end on a multitude of different test scenarios. And that's really the crucial part that says you are ready to go.
Okay. Madam Chair, this is Leslie Johnstone. You may have said this, Mr. Haycock. When is the broker and navigator training to be conducted?
So the broker training is already available today, and there have been a series of brokers and agents that have communicated to the exchange that have already gone through that process and are ready to go. The navigator training is supposed to be released next month, and the moment that it is, we will get a notice and we will send that out and circulate it out to all of our exchange enrollment facilitators.
This is Leslie Johnstone again. So they're being trained on a system that isn't ready for end-to-end. What I'm worried about is the back and forth that is inevitable with the Division of Welfare and Supportive Services. And I think that kind of overwhelmed us last year, knowing what was involved in that process. And I want to be comfortable that the brokers and navigators know what they're in for in that aspect as well.
And I completely understand, Ms. Johnstone. And if you would like, I can kind of describe a brief scenario going one way and then the other, and maybe that might put things at ease. So our navigators and enrollment assisters, as well as our brokers and agents, unless they're enrolling a shop employer or they're doing what they call direct enrollment for their insurance carrier, they're going to have to do side-by-side, sit with clients, and their clients are going to sign into their accounts, and those brokers and navigators will then assist them through that process. They may have to three-way call the call center at healthcare.gov, or they may be able to sit with them and get them through that whole process, either in their office or sometimes over the phone. But they're not going to have an actual broker or navigator portal into the system to enroll individuals and families on the individual market. CMS has not developed that process, and they have announced that they are not planning to, at least for 2015. So that situation is going to be a little different for them. Currently, to answer your concern, there is 2014 training materials that are already located out there at CMS, and we have circulated that information to the navigators and the enrollment assisters. So it's my understanding that they have already started looking at that documentation, screen by screenshots as to how to navigate that system. They just are updating it for 2015 based on lessons learned from 2014. As far as going through Access Nevada, traditionally brokers, not to say that they don't, but traditionally they don't enroll folks in Medicaid or Nevada Checkup, but those that do will be able to use the same single streamline application they're used to seeing, just using a different entry point. And so they'll be able to assist folks through Access Nevada's single streamline application until they get an eligibility determination. So at the front side, it's going to look a little bit different, but it's going to behave very similarly, hopefully with less bugs and hiccups. But basically, individuals that come to Nevada Health Link that want to enroll in health insurance or in Medicaid or Nevada Checkup will be pre-screened through the pre-screener tool that Deloitte has built for the Division of Welfare and Supportive Services. And they will be able to hopefully go to the right place the first time and reduce a lot of that account transfer and handoffs. So that's our goal, to assist Nevadans in making this transition.
That helps. One last question, I think. When are to be ready for testing and then training?
So the pre-screener tool is already designed, it's already being built, and we are going to be incorporating that into the Nevada Health Link landing page as basically a call out. And so we're able to participate in any testing that welfare provides with us or to us in the meantime, but we're looking at probably near the end of next month being able to incorporate that, if not into October, for the landing page.
Won't that be a big part of the broker and navigator jobs when they're working with people that are potentially Medicaid?
And it will, Ms. Johnstone, and maybe I need to give a bit better overview when I answer questions, so please forgive me. That pre-screener tool is only going to be, I think, 6 or 7 questions that basically define the federal poverty level of the individual and their household to help them determine if they may qualify for Medicaid or Nevada Checkup and or a qualified health plan through healthcare.gov. And so the whole point of that pre-screener tool isn't supposed to replicate the single streamline application, but to give the individual an idea as to where they probably need to head to first. And then there'll be direct links out to healthcare.gov and to Access Nevada to enroll in Medicaid and Nevada Checkup. And so that pre-screener tool is very important, but it's also quite simple on the front side. There's a lot of coding and a lot of interdependencies on the back side. The pre-screener tool will reach out to the eligibility engine currently housed in welfare to determine the MAGI rules and come up with what you may qualify for. But it's just supposed to send you to the right place or as close to the right place as possible the first time to reduce a lot of that account transfer process.
Okay, thank you very much.
All right, Mr. Hayek, one last question for me, and it relates to your topic of brokers and agents. Will CMS or whomever is taking care of that broker registration be able to let us know how many of our Nevada brokers and agents and producers have gone through that process?
Madam Chair, it's funny you mentioned that. That was the exact question I asked them on Tuesday of this week at our regular scheduled meeting, and they said they would get back to us. So that request has been made on behalf of the exchange, and we're very interested and anxious to get their answer. We hope to have an answer by the next board meeting.
Thank you. There are no other questions from board members to Mr. Haycock. We'll go ahead and close this agenda item and move on to agenda item number 6, which is the update on the Consumer Assistance Advisory Committee. And Ms. Edkins would have normally done this update for us today, but unfortunately she's had a family emergency and is out of town. So I'm going to ask Ms. Shauna DeRoos if she would give us a brief overview of what that report would have been.
Sure, for the record, Shauna DeRoos. Actually, Damon did a really good job of talking about a lot of what we talked about in that particular meeting. We had a lot of general discussion regarding the differences, the coming changes between last year and this new open enrollment and what the brokers and the assisters are going to have to go through. We talked about the training, the fact that brokers have the training out now. We're already hearing that a lot of the training is that people are going through. Brokers can take the training in modules. They can elect to take the extra. There's another module separate for shop if they would like to. We're hearing some are, some aren't. We're hearing that a lot of the current assisters are going out and pulling down that 2014 training, even if they know that it's going to be updated for the 2015 plan year. So, and we will let them know again, just like Damon said, as soon as that is ready. We talked about the concern about what would happen to a Nevada citizen who had a request or a concern. Our citizens have learned that our board is very receptive. They can come to us, they can call us, they ask us to help them. Our concern was, what do we do to help our citizens going forward? And so again, another question that has been posed to our federal partners is there a way for, say, Shauna, on behalf of client Tyler, to call and say, I need help for this person. He's having problems with your system. So we're looking at how we do that, how we go through that process with the feds, because it's very, very different than what we do now. We also talked about the marketing campaign with KPS3, the focus groups that were happening, everything that had to happen very, very quickly. We talked about some changes to maybe how we could reach out to people. We talked about some static locations, some storefront locations during open enrollment, because events like the Cashman Center event and things were so helpful last time. We talked about those static locations. We talked about roaming navigators and organizations going out and working in the communities as well, and how they would go out there, where they would go, what they would need to do that. And the middle of winter may not be, I'll find out. This will be my first winter in Las Vegas, but certainly in the north, roaming around in the middle of winter at Christmas time can have challenges when you're trying to be outside. We talked about the Medicaid and the concerns that we had about kind of that flood that we had last time, and what we can do to help the Medicaid and our partners there, and directing those clients. And the fact that now it's not technically that one-stop shop that you just heard, because there are actually separate locations to send people to, separate websites that they will go through, and separate applications. And what happens when a person goes through the one, gets denied, and then has to turn around and go through the other. So those were the general topics. In addition to everything you just heard from Damon, there were no recommendations for the board at this time. The committee is meeting again in the first part of the month, next month, and we may have some recommendations to bring back to the committee at that time.
Thank you very much. Let's move on to item number 7, which is the PCG Boston Reconciliation, which is an update again from us.
Actually, that's going to fall to me.
All right, Mr.
All right.
Gilbert.
Thank you very much, Bruce Gilbert, for the record. I am pleased to advise the board that PCG will be in Las Vegas next Tuesday for their inaugural meeting with carriers to assist us in the following areas. First and foremost, with open cases that currently exist. Our intent is to speed those particular issues toward closure and resolution, and specifically, PCG is going to assist us with finding ways to improve the process, consolidate our efforts, and get through that caseload quicker. So that's one of the things they'll be doing for us. The second area that they will be working with us on is member reconciliation. As we spoke before, we're going to be bringing additional resources and expertise to explore the problems in this regard. We'll be looking for data anomalies and inconsistencies. We'll be looking specifically for process refinement and commonality, both to understand the genesis of these particular problems and to find a faster path to resolve the issues. So my understanding is that they are setting up appointments with the carriers for next week, and that effort should be well underway very quickly.
Do we have a count of how many cases are in the caseload? How many are we at right now?
Yeah, the caseload, and Shauna was kind enough to share this with me, the caseload on July 31st was in excess of 10,000. And the caseload at August 13th had been reduced almost by half to just over 6,000.
And they will be busy.
They will indeed.
All right.
Madam Chair, this is Leslie Johnson. I would just have a comment that because of, I think, the importance behind getting these cases resolved, I would hope that we think pretty aggressively about how we use PCG, and if we need any additional resources, that you work to make that happen. So, you know, we have a goal of getting the cases resolved by the end of August or end of September, but soon.
Right, and one of the things that I think that PCG can help us with is to make sure that we have our arms around everything. What we don't want to do is say, here's what we think the number of open cases is, when in actuality, perhaps it is or is not. So they're going to help us identify that, and then based on that and the efforts that they can bring to bear, we've also talked about bringing 2 additional staff members on to move through that process. And obviously, once I have a better idea of the universe, it'll be easier for me to tell you how many more resources I think we need to commit to it.
Do you know how many individuals they're sending out to work with us?
Next week. So the meetings that are happening next week, I'm sorry, this is Shauna Doris for the record. We have one expert coming from PCG to help us on the caseload. Now, this is not that he's going to roll up his sleeve and help us, but he needs to learn what we're doing and learn, to understand the universe before he can see what a recommendation might be. We've set up kind of interviews and discussions with the call center manager, with the unit manager, with some of those people that, and how the process flows, where the information goes when the call center has to work a case, but then they have to send it over to finance, and then finance gets it done and they send it over to the EDI transfer. Where those stopping points are to find out how we can streamline this effect and make it go a little bit faster. So I have one person, one real expert for the call center coming in. Now, on the member reconciliation side of the house, there are several people coming in. They are going to, we've given them a list. There's an entire kind of universe that we are asking them to go out to the carriers, meet with the carriers, learn really what is happening when a carrier gets that 834, 820, or ACH. Because what we're finding is, for example, if a carrier says, we never get this piece of information, and we know, well, it's on the 834. We believe they get it every single day, right? So what happens to it, and how come they feel that they don't have it? So we need to go to their process and say, well, when they actually receive that 834, what happens to it? And what pieces of information do they take from it and store within their system? So we've given them this kind of long, very long list, and they're going to bring that back to us, because that'll actually help us then do this member reconciliation and see where people are falling off or information may be kind of getting lost in the system.
Okay, so that's starting on Tuesday.
Yes.
That part. How many boots are coming in for that?
So I believe that there are 4 boots coming in.
One for each carrier?
For that. They're a little bit sequential because there's so much information that has to go. They'll meet with one carrier at a time, not separately. Because there's actually at different carrier locations, they're going to have a group to talk about it. So they're meeting with the Southern Nevada location in hopefully Wednesday and Thursday. We're getting those set up. Then they plan to travel up north
and visit with St. Mary's in the North on Friday. And then the following week, we should get a report back, and then the plan is, then we start rolling up the sleeve and actually diving in. If one carrier, looks at their member count and we look at ours and there's like this delta of 100 people that are missing, they're literally going to roll up their sleeves and help us find that 100 people. We've started the security process, the background checks necessary in order to do that. We've started the NDA process that we're working on between Xerox and the exchange and PCG to make sure that we can share all of that privileged and confidential information that they will see when they get in there. So there's a lot of steps that we have to go through. We feel, I think, pretty comfortable that we've at least got a starting point, and we absolutely understand that once they get here and we start looking and uncovering, we're going to find new things, and we're going to have to be a little bit flexible and reactive and be able to jump on it when we can.
Are those NDAs executed yet?
They are not executed yet. I'm in the process of working with, Dennis sent me the NDA that Xerox and he worked on, and they were forwarded, so we're in the process.
Okay. When do you expect to have signatures on those?
Either maybe they'll bring them with us on Tuesday, maybe that would be nice, but we'll get those very quickly.
Okay, and Xerox's side, their side of the NDA?
I don't have a signed document. They gave Dennis a document that they agreed to.
Okay.
And so we're working through that process.
Okay, so we don't have any
I don't have a
issues
signed-
between the parties
No,
at all?
I don't
No, the form should be done.
All right. Do we have any questions from board members to Mr. Roos about this reconciliation process?
No, this is Dr. Jameson. I understand that we just have to understand the scope of the problem better before they can give us a really good date to reconcile it all.
Ms. Kerr, do you have any questions?
No, thank you.
Okay, and our ex officio members, any questions from you?
No, thank you.
Okay, thank you very much for your report. Let's move on to agenda item number 10, which is the discussion and possible action for procuring a marketing vendor for 2016 enrollment year. And skipping number 8. Oh, I'm sorry. I apologize. We're at number 8. Update on the Silver State Health Insurance Exchange Alternative Acquisition Survey for 2016.
Yes. Again, for the record, Shauna DeRose. Because of that, we're calling it the survey.
Okay, thank you.
It's very long. So just very quickly, the board supported staff efforts to go forward with kind of that alternative approach to the RFP because of our shortened time frame. And so staff worked with not only exchange staff, but it was staff from the Division of Insurance, staff from Enterprise IT Solutions, staff from Welfare and Supportive Services. We had state purchasing, and Ms. Johnstone helped us out as well through that process to create the survey, kind of put those functional requirements together and ask the questions that we needed to ask these vendors and come back with something much more concise than a traditional RFP. I don't know if you recall when we talked about it last time, but we got over 1,000 pages back from those vendors. And knowing what we know now, there was so many unknowns before. Now we know exactly what we need. We know what those requirements are, and the vendors do too, because all of these vendors have done it once before. So we went to the CMS website. We talked to CMS, and they pointed out that the systems integrators and the web portal providers were listed on that website, and we came up with 9 different organizations to send the survey to. So the survey was sent out all electronic, in electronic fashion on July 31st, and in the report you'll see kind of this the time frame that we're looking at here. We don't expect to receive vendor responses back until the end of this month. I will say that I've gotten a couple questions, very quick questions regarding the survey from some of the vendors, and it was pointed out to me this week that at least one of the vendors was kind of, where was the survey and where did you send it type thing. So we were making sure that we're reaching out to all of them that haven't at least contacted us to make sure that they did indeed receive that survey. If we need to push out that date because of some extraordinary circumstance, there is a little bit of room in the current that we could push out a week or deal with it that way. We do plan on having the responses, review of the responses, vendor demonstrations, and then looking at who the preferred vendor might be, and then we would bring that back to the board on the 8th, 10/8, and then work through the contract. I will say also that the survey was sent to CMS for their review. They had, 5 questions, I believe it was, and they were very general questions. One of which was, are you sure you want to ask for that high of liquidated damages? We said yes. And the understanding that this was not a purchase of a software solution, because again, that software solution has already been purchased, is the thought process that the feds have already paid for this somewhere else. We're bringing it into Nevada, we're paying for that implementation and the requirements of hooking up to our state and making this happen. So I will say that it's going well so far. I think that we put out a good document. I hope that people follow the directions, send it back electronically, send it back concisely and 50 pages. And as soon as they do, we'll get it out back to our team members for review. And hopefully then we'll be able to come back to the board with some information.
Does anyone have questions regarding this? I do have a couple because I'm getting a lot of phone calls from people on this, as all of us are, I'm sure. I have received a comment from someone that the electronic form went to someplace it shouldn't have gone. So I have given them your name, so you can send it to some other place, wherever it needs to go, because time's cooking away.
You bet.
I've also had some phone calls from individuals that they say they should be on the list and they're not. They're working through that with CMS. Is there any reason why they could not get the survey to be working on it? And if they aren't on the list by the time we need to make the choice, they automatically default off?
So I believe that there were a couple of vendors that were added to the list at the last minute because they were on that cusp of being added to CMS's list, and we did include those at the request of the team. And so I think that we reached out and we got the proper vendors to include on the list.
Okay. If there are other outstanding ones that you might not be aware of, if they contact you, is there any reason why we couldn't give them the survey if their name doesn't come up on the list by the time we're making choices? They just fall off?
I think I would have to take that back to the team. I think at this point, we're almost getting to the point where it's too late for them to get their response in. All the responses need to come in at the same time and be reviewed together. It's not a case of getting one response or 2 responses 2 weeks later, because when we look at all the responses, then we invite a vendor or 2 to come in for the demonstration, and we would be pushing wait and see if somebody perhaps wanted to do that.
I'm not suggesting changing any timelines.
Okay.
They're at risk on it. I mean, if they can get it done, they can get it done.
Mm-hmm.
If they get their name on the list, their name's on the list. If they can't get it done, they fall off. If they're on the list, they fall off.
Okay, I see.
But I'm just trying to keep the opportunity open for people who feel that they should be part of the list, and maybe there isn't clarity on it yet.
I would say then put forth their name, and if they fulfilled the requirements that we set forth as the team, that they were an integrator or the developer, then we could look at that. And maybe they do meet those requirements and we missed them, or maybe they don't and they didn't understand what our requirements were.
And I do want to put on the record again, because people are going to get tired of hearing me say this. This is a risky solution that we're looking at, and there is absolutely no guarantee that the board is going to go down this path.
Absolutely.
Even though we are going through the process at this point in time. So I just keep wanting to tell people so that they know that there's a lot of time, energy, resources, and money that is spent by companies as they go through this process. But the board has not made up its mind whether or not we're going to pull that trigger on this. And I just keep wanting to remind people of that so no one's blindsided.
Absolutely, and I think our efforts are to bring the best and the most and best information back to the board so that they can make the right decision for Nevada. So,
Madam Chair, this is Leslie Johnstone. I wasn't able to attend all of the calls all the time. What was the final approach decided upon for the call center and issuance of that RFP?
So there were kind of a couple of thought processes, and you were involved in, I think, in a couple of those conversations. So we did not include specifically the call center operations in this survey. The thought was that if, say we picked a particular vendor, if that particular vendor had then call center operations that were integrated into their solutions, we can have those discussions at that time. If not, we can look to leverage call center solutions that are out there. As you know, cost is a major concern for us going forward. And so we really want to look at leveraging existing call center operations because, we're going forward. It's not a 6-month or a 3-month open enrollment. It's a 7-week open enrollment. So I think that we're looking to see who we end up with for the solution, see what opportunities are there to leverage, and also then we can do, if there are none, call center operations then can be done very, very quickly. And I've been in touch with state purchasing to talk about existing call center RFPs or shortened also timeframe procurements that would help us get through that. But we have a little extra time on that one because the development is not up front.
Right, I understand that. Does that impact our ability to include the cost of the call center in the next, or in the final funding application?
I do not intend for it to preclude us from including that in our funding application. No, there will be funding requested should we go down that path.
Thank you.
Any other questions from board members or ex officio members? All right, we'll go ahead and move to the next agenda item. Now we are at 10. Let's discuss possible action on procuring a marketing vendor for 2016 enrollment year. Who is Mr. Bruce? Sorry.
And I would say normally this would be a tighter report going forward, definitely. But since this is all of his first week, we're going to share the responsibility here. The board had asked that we bring back this report so that you were able to have the discussion about whether or not it was in the best interest of the exchange to look at a new marketing vendor. I believe now that was an extremely wise choice because when I put together the sample timeline to do this, it would be pretty imperative that we make that decision today. So I hope that the discussion here today will enable us to go forward with an RFP should you so choose. So on the December 13th, 2012 board meeting, you ratified the selection of KPS3 as our marketing vendor. We had gone through a full RFP with that. The choice at that time was through competitive bid. It included the help of the Division of Insurance. It included purchasing. It included welfare. We had a group, again, that went through that RFP process for us. At the time, it was a $6 million contract, and it would have gone through March 31st of 2014. Since then, that contract has been amended to $11 million and extended through 3/31 of 15 to get us through the next open enrollment period. When you look at the funding for future marketing, recall that our grants are ending and that they did say, the federal government did say that we could extend our marketing funding in our current grants through the next open enrollment. So our funding does go through February 15th of the next year. However, after that, marketing will have to come out of our PMPM. So again, our marketing budget will be limited by our enrollees and the amount of money that we can put forward there. The exchange, not knowing exactly how many enrollees we will have until the end of the next open enrollment in February, I kind of looked at this as backing into that date of we need to know how much money we have so we know how to negotiate a contract so that we can go forward to the BOE. So as we put together the timeline here, it was kind of with that expectation that we would know that in March we could go to a February BOE, still have time then for the marketing vendor to have that contract and be ready for the October 15th, October of 2015 open enrollment. So if you look at the development of the RFP timeline here, it would really need to start very quickly though to do that. Now this is rough, and there's definitely a little bit of time here. But if we started this, let's say at the 1st of September, we go through the process of creating that RFP, definitely using last time and lessons learned as a template. We would be able to have that over to purchasing within a 2-month time frame or less. We could get the questions. We would give that opportunity for questions and answers, come back, get the responses back from vendors, go through any demonstrations if we want, or just go right into the selection of the vendor, negotiation of the contract, and then again going to the BOE in April. So knowing this as our time frame, we felt that there were 2 options for the board today. One is to extend the KPS3 contract. This would allow the transition from state-based exchange to supported state-based exchange, and possibly, maybe, back to a state-based exchange with that continuity of the same vendor, people who have understood where we've been, where we're trying to go. The second option, of course, would be to go through that request for proposal process and possibly get fresh ideas, new insight, new ways of looking at this. There's definitely time. There will be funding available for that. And while resources, because we do have a lot of other things going on right now, resources may be scarce, but the staff is definitely dedicated to make sure this happens per the board's direction. So I guess the recommendation today is just that you make a decision from one of these options or another option if we didn't bring one forward that is suitable. So, thank you.
Have any comments or questions to start the discussion?
This is Leslie Johnstone. I just have a comment that will tip my hand about my position on this. I think it's always a good thing to shop around every so often, and there is so much money at stake that it's pretty imperative that we do that. I think 2 years is a long enough time that we've got a good idea of what we want out of a marketing vendor, so I would support going to an RFP. And that's not to say that KPS3 wouldn't be the selected vendor, but I think it's always a good idea to see what's in the market.
This is Marie Kerr. I think KPS3 has been doing a very good job of doing our marketing, and I would actually, I think that option 1 is a better option.
This is Dr. Jameson. I would agree with you. I think they're doing an excellent job after they presented their report at our last meeting, and I also reviewed it again. I think they are doing an excellent job, and I would go along with that first recommendation.
All right. I think KPS3 has done a good job. On the other hand, I think it's part of our fiduciary responsibility to make sure that there are checks and balances on this. I would be voting the same way that Ms. Johnstone appears to be voting on this, and I would hope that KPS3 would come forward and be one of the vendors that would like to go through that process. But I think it's part of our financial responsibility, citizens of Nevada, particularly since we're now taking those funds out of the per member per month category, that we make sure that we're selecting the vendor for the right price, for the right circumstances. So we've only got 4 members here today. Does anyone want to make a motion?
Madam Chair, can I make a comment first?
Yes, please, Ms. Teska.
Yeah, this is an area that actually falls under my department, is purchasing and contracting procurement. And I just want to point out that I agree with Leslie's comments from the standpoint of just because you go to RFP, that's not a reflection on the performance of your current vendor. It's keeping the options open for the agency. And we have lots of cases where we are going to request, by statute, you're required to go every 4 years for contracts. I'd also point out that competitive bidding and of contracts has been a significant issue on the legislative agenda the last couple of sessions in terms of ensuring that we're going through the RFP process and not just renewing existing vendors on an ongoing basis. Those issues have been discussed frequently in the last couple of legislative sessions. And so it's just, to me, it's, you don't, yes, there's effort put into doing an RFP process, but it actually protects the entity a whole lot more than just saying, well, we have a vendor that's doing a good job, let's extend the contract, because you may be able to find someone out there who can meet your needs, especially since your resources are going to be markedly different. You could find a vendor that could meet your needs within a different cost structure that might be better going forward. Again, nothing to say that your current vendor doesn't end up winning the RFP. This just allows you to keep your options open. So while I'm not a voting member, I would certainly encourage the board to consider going with the RFP option.
This is Marie Kerr. Do you think it might be a good idea to wait until we have more voting members present rather than just an even split of 2 and 2? Just a thought.
You know, it's unfortunate that we have a quorum of 4 today, but I think there's a sense of urgency, and staff has so many things on its plate right now that I hate to extend it out.
This is Dr. Jameson. I absolutely would agree, you know, in this case with just both, and since it's certainly always safer to go ahead and do another RFP and we can only gain from it, I just wanted to go on record noting what an excellent job the current company has done. But I certainly am not opposed, and I'm more than willing to go along and recommend that we do an RFP.
Does anyone want to make a motion so that we can see how the 4 of us feel on this?
I will take a stab at that. This is Leslie Johnstone. I'll make a motion that we direct staff to proceed with an RFP for marketing services beginning open enrollment 2015.
Is there a second to that motion?
Dr. Jameson, I will second that motion.
Thank you, Dr. Jameson. Do we want to have any further discussion before I call for the vote? All right, why don't we take a roll call vote on this one?
Do that. Thank you. Ms. Johnstone?
Aye.
Dr. Jameson?
Aye.
Ms. Kerr?
I'm against it.
Madam Chair?
Aye. All right, I think staff has its directions. We'll start into an RFP, and please, this is absolutely no reflection on KPS 3. I sat through a working session today, and I'm very pleased with what they're developing, and I hope that they will continue to want to be part of the RFP process. All right, let's move ahead to agenda item, oh my gosh, we're moving ahead here. 11, update on the enrollment statistics to date. Is that Ms. Rich?
For the record, Laura Rich. The purpose of this report is to provide the board with updated enrollment statistics as well as a state-based marketplace comparison. So I'm going to start with the latest enrollment statistics. First, the first table there is broken out into 3 categories. The first 2 columns are broken out into open and special enrollment periods. We won't go over those. Those have been reported on in previous board meetings. The third column are the up-to-date totals, which in this case are through July 31st. So since the end of special enrollment, if you do the math, we've had approximately 29,000 individuals come to Nevada HealthLink and complete new applications. The number of confirmed plan selections, so that's people that have come in, completed an application, and actually selected a plan, has decreased slightly because a number of past plan selections have now expired. So if those people that previously had selected a plan and paid for it by June 15th, they no longer qualify to enroll unless they meet the criteria for a qualifying life event. So that's why we've seen a drop in confirmed plan selections. And we won't likely see an increase again now that we're out of any special enrollment period. So our effectuated enrollments are now at 37,937 for medical plans and 30,042 for standalone dental. So moving on to call center stats, these have remained pretty steady. The call volume has dropped significantly and our wait time is down to about 2 minutes, with most of those calls averaging between 12 to 13 minutes to complete. The next table is the enrollment by FPL, federal poverty level, and this hasn't fluctuated much since the last report, so the breakouts remain relatively similar to the last time I reported on this. This is also the case with enrollments by carrier, HPN, and the co-op continue to share the largest chunk of the enrollments, followed by St. Mary's and Anthem. At the last board meeting, the board members requested information on qualifying life events, QLEs. So these are defined as a change in circumstance that can make a person eligible for a special enrollment period in order to enroll onto a qualified health plan. So examples of these triggers are events such as marriage, birth, relocation, loss of income, or loss of minimum essential coverage. So in total, we've processed 1,177 QLEs. 277 of those were in force, meaning those were changes to current policies. So people that were already on the exchange, already had a policy, and they experienced a qualifying life event that triggered that special enrollment period. So 900 of these were new, meaning that they were not previously on the exchange. And of the 1,100, about 425 have been approved, 175 have been rejected, and the remaining are either in progress or pending some sort of documentation. So the QLE breakdown is provided below. This includes both the complete and pending QLEs. So loss of coverage seems to be the most frequent occurrence at about 55% of QLEs that have been processed, and followed by relocation at 21.1%. So the board also requested at the last board meeting a comparison of state-based marketplaces. So I want to start off by providing the board with an overview of how this data was collected and maybe a brief history. Back before the exchanges went live in October, the state-based marketplaces, in conjunction with the Center for Consumer Information and Insurance Oversight, CIO, developed standardized performance measures consisting of 13 core assessment areas and 800 data elements. I think I went over this briefly at the last board meeting. On May 1st of this year, the ASDE Office of Health Policy published these results, documenting both the state-based marketplace trends and FFM trends as well. Federally facilitated marketplace. So according to the published report, about 8 million individuals selected a plan either through a state-based marketplace or the FFM, and about 28% of those were young adults under the age of 34. Both markets also experienced a surge of enrollment activity at the tail end of the open enrollment period. So the data presented in the tables is enrollment data through April 19th. Many of the SBMs followed the federal guidelines and allowed applicants who were unable to complete the application process by March 31st to enroll individuals up until April 15th. So some states, like Nevada, decided to extend their special enrollment periods beyond that to dates beyond 4/15. So anything that occurred after that 4/15 cutoff date is not included in these metrics. So if you take a look at the first table, Table 1, it illustrates confirmed plan selections. So if you recall, Nevada is one of the only states that took on direct billing. So we have been able to track and report effectuated enrollments, whereas other states have not necessarily had this ability. So in response, CMS has relied on reporting confirmed plan selections and has yet to receive any or to report any information on these effectuated statistics, at least publicly. However, several issuers, such as Blue Cross Blue Shield and WellPoint, have made public statements indicating that about 80 to 90% of the people that had selected plans in the marketplace went on to actually pay for them. So when you compare Nevada's numbers to this, we run slightly lower at about 75%, most likely due to system errors and things that directly affected payments through our open enrollment and special enrollment period. Table 2 shows selections by metal tier. You can see that with just a few exceptions, most state-based marketplaces had their largest percentage plan selections onto silver plans. Keep in mind again that these are plan selections and not enrollments. So Nevada reports largely on enrollments, or the board hears reports on the enrollment numbers. These are confirmed plan selections. So as you can see from the bottom line on this table, Nevada's tier selections are fairly consistent to those in the marketplace. And when I say the marketplace, I'm meaning the FFM as a whole as well as SBMs. So the next table breaks out plan selections by financial assistance. This is including the advanced premium tax credit and cost sharing reductions. Again, Nevada is in line with the marketplace as a whole. Table 4 provides a demographic breakdown on age. So CMS reported that plan selections by 18 to 34-year-olds increased throughout the open enrollment period, specifically at the end. Enrollment in this age during the last 4 weeks increased by 109% versus 82% in all other age groups. And something I want to point out that this table is comparing plan selections in the FFM and SBM versus actual effectuated enrollments in Nevada. So you can see our enrollments by age differed slightly from the average in the marketplace. Most notably, we had a higher percentage of enrollments in the 55 to 64 age range, and then lower percentage of enrollments in the 45 to 54 age range. So the last table is an ethnicity breakout. So while the populations in each state, specifically race and ethnicity, they vary from state to state, minorities generally make up a disproportionate number of the uninsured population. So according to the the 2013 U.S. Census survey, Nevada's Hispanic population made up about 27.5% of the population, which is higher than average, than the national average, I should say. It is important to note that the race data is collected voluntarily. So Nevada Health Link, when you go onto it, you can actually elect to skip that page. However, we show that about 95% of effectuated enrollments, those people that enrolled did choose to provide that data. The number is not available for the marketplace as a whole. So again, this is comparing completed plan selections in the marketplace versus actual effectuated enrollment in Nevada. And our enrollments are off slightly from those reported in the marketplace as a whole. However, some of this can be partly attributed to the fact that Nevada's population is different than the national average. So, there's different reasons for that. But with that, I'll take any questions.
Do we have any questions for Ms. Rich?
This is Dr. Jameson. Just in Nevada, the Nevada population in general, what percent is our Hispanic population?
The Hispanic population is about 27.5%.
Oh, I didn't mean on the number of people that signed up on our study. I mean, in general in Nevada, what is the Hispanic population?
So in general, the Hispanic population is about 27.5%. However, the percentage that signed up through the exchange we're at about 20.3%.
Oh, and then you said the Nevada population was slightly different from others in the general population because what were some of the key reasons you said we were different? I mean, what are they?
So the population is different just based on ethnicity in itself. You pointed out one was the Hispanic population. The Hispanic population in states such as Arizona, Nevada, some of those southern states have a much higher percentage of Hispanic folks. Then we have maybe in other states, they have a higher than average percentage of African American. So it's sometimes difficult to compare your enrollments to other states because the population makeup is just so different from state to state.
Do we have any other
You're just
questions
referring
for Ms.
to the ethnic makeup. That's the populate. That's what you're talking about. Just the ethnic makeup.
Right, the ethnic makeup is different from state to state. So when you compare state to state ethnicity breakouts or enrollments, you do have to take into account that there might be a lower population of Hispanic people, for example, in Montana versus in Arizona.
Do we have any other questions for Ms. Rich? All right, thank you for a very comprehensive report. Moving along to the next agenda item, I think it's the monthly budget projection, which is our number 12. And Ms. Eaton will be taking this agenda item.
Thank you, Carrie Eaton for the record. This monthly budget projection report has not changed significantly since the last time that this report was presented. On page 2, you'll see that the tables have been updated, and there's not much left in the pending and projected. What the last remaining transactions in the pending column will process through the state system in the next week or two, and we'll be able to close out our state fiscal year 14. You may notice that the percentage of expended available budget has decreased since the last report, and this is due to removing the Xerox projections for the BOSS contract. As the contract negotiations are still in progress, any of the payments that are made to Xerox will now happen in state fiscal year 15, so they have been removed from the projections for state fiscal year 14. The only other thing is the budget building process is still underway and will be completed no later than August 29th. And next month, I will update you on our state fiscal year 15, our current state fiscal year, and how the budget building for state fiscal year 16 and 17, how that was submitted.
Thank you, Ms. Eaton. Do any of the board members have questions? All right, thank you again for that update. We appreciate it. Moving on to item 13, discussion and possible action items for our next agenda. And our next will be on September 10th? 8th. September 8th? It's always the second Thursday. Let me pull up my calendar.
Second Thursday is the 11th.
Oh, we're off. Both of us are off. Okay. Thursday, September 11th will be our next board meeting. Are there any items in particular that board members, including the ex officio members, would like to request to have on that agenda or any future agendas?
This is Leslie Johnstone, just more updates on the progress on bringing up the system for open enrollment 2014 and on the account reconciliation.
Thank you. Why don't we make sure that we really give enough time for both of those, because it's getting to be crunch time. Yep. And I know the board really wants to do that. Any other suggestions from board members? Okay, we'll go ahead and work on those agendas then. Let's move on to public comment. Is there anyone in Carson City for public comment?
No, Madam Chair.
Thank you. How about here in Henderson? So we have one person here. You'll identify yourself for the record, please.
Dwight Mazzoni, independent agent, producer, licensed by the state of Nevada. I'll submit this in writing after the fact, if you don't mind, Madam Chair.
Thank you.
This is a commentary about the upcoming SSVM change that Nevada is going to go through. And hopefully this will shed some light on issues that have impacted the enrollment and on groups or ongoing service with regards to Nevada citizens who avail themselves of the health insurance and public benefits, parentheses Medicaid, that they've acquired through the exchange. By the way, I've been part of the Consumer Advisory Task Force, and so therefore been through a lot of this. And this is submitted as a little bit of background information, but also some general overviews for us to be prepared as we move forward, particularly with Mr. Gilbert coming on board and having to learn a whole new world here in Nevada. And there's no H in Nevada, sir, just so you know. We always tell everybody that.
We told him we wouldn't hire him if he said it wrong.
That's right, she did. She did.
I'm sure. Enrollees who tried to enroll on their own or through enrollment assisters who were not knowledgeable about benefits, deductibles, co-pays, or co-insurance. Statement of fact. Consumers had little or no education about the prescription benefits. Consumers were obtaining plans that did not have their medical provider in the plan or network, in spite of continued efforts to make sure that was done initially by the website for the exchange, and then also trying to work with the carriers. And there was a lot of confusion, as we all know, with some of the carriers as to who's a carrier or who's a provider. I'm not a provider, by the way, by definition, provider in the sense I'm using it as any kind of medical provider, a doctor, a facility, whatever. Many consumers bought up a plan. In other words, instead of buying a bronze or a silver plan, they would buy a platinum or a gold plan, thinking they were getting better benefits, not understanding, and the training was not sufficient for anybody that was helping these people to help them understand that a silver plan was probably the best bet because of APTC and the CSR issues that went along with that. That has created and continues to create quite a bit of problems for people. There are people that can't wait for open enrollment to get off a platinum or gold plan, cover their premiums, and get into, if they qualify, an APTC plan with a CSR. Many Nevada citizens did not understand APTC, annualized premium tax credit. We have a concern that come tax season in 2015, that there are going to be a lot of very surprised people when they find out that they're going to have to reimburse the federal government for money they received under APTC. And also, there was a huge lack of education on the CSR provisions of the exchange-based plans. And
Mr. Mazzoni, if I might interrupt you, your public comment is very important.
Yeah, I apologize. I have an early flight and have to go.
And we're going to lose a couple of people here tonight.
And you know how to get hold of me.
I do.
And you are putting this in writing.
Yes, sir. Thank you very much. Thank you, Madam Chair. Thank you, members of the board. Thank you. Thank you.
If you want to go ahead and conclude.
Additionally, the consumer did and does not to this day understand the true out-of-pocket maximums or the real cost of being covered under any of the plans that we sell through the exchange. In fact, some people don't understand even it's not part of the exchange. The above and many other service-oriented issues resulted in extraordinary demand on insurance carriers, medical providers, and agents. As a matter of fact, we have medical providers that said, don't send me anybody that has one of those Obamacare plans, quote. How can I send them somebody that doesn't cover by an Obamacare plan when all the plans are, quote, Obamacare plans, if you will, because of the requirement of the benefits? It also created an extraordinary demand on agents and agents' offices servicing the clients. Long wait times, not just on the exchange, but also with the carriers. The 4 carriers that were on the plan, on exchange, sometimes had wait times of 1.5 to over 2 hours, corresponding with what we had with the exchange. Hold times prior to 1/1 of 2014 were approximately 5 minutes. This is a survey done by the carriers. After 1/1 of 2014, hold times would exceed more than 60 minutes. So not only are you being waiting for someone to just answer the phone, then you could be put on hold and be another 30 or 40 or 50 minutes, whatever. There are many facets as to what happened with the Silver State Exchange. One of the facets that adds to the mix is the lack of use by the insureds of an agent or producer. Agents are educated by carriers, the state, and also by our own professional organization, National Association of Health Underwriters, the Big I, NAFA. There are many of them in the state. And many agents from many of these associations have been involved with the exchange. This allows the insureds to find assistance in all aspects of their policy. The assistance runs from selecting the appropriate plan, explaining the benefits, helping with claims and billing and other service issues. And we would like to think we are looked on as an asset by the carriers because we take a load off of their backs when we're helping clients solve these problems and resolve billing issues. In fact, on my way here, I got a call about such a billing issue. I was sharing a little bit with Ms. Johnstone, and we still have the problem. We have to have somebody as an intermediary, an ombudsman, if you will. The bottom line is a producer or an agent acts as an advisor or ombudsman for the member or the client, providing a very needed service at a lower cost, no charge to the exchange, by the way, and with education. In some of our instances, many, many, many years of working within the system and understanding how the system works. As one of those people that's ancient and old in this business, I'm one of those people, and I can tell you I get calls from younger agents all the time. How do I handle this? Who do I go talk to? How do I deal with this? I'm not saying we don't need navigators or assisters, and I'm not saying we don't need the telephone people here with whatever Nevada Health Link becomes in the future, although I understand we're going to have some different communication issues in the future. But I'd like to see and make sure that in all of the efforts that are going to happen in the future with KPS3 and whatever else is going to happen with the exchange, that agents are put as one of the primary members of the team. We want to be part of the team. We want to help the citizens of the state of Nevada. We'd like to help the exchange. Many of us, I can tell you, until just recently didn't realize that if we sold a plan outside the exchange, an off-exchange plan, if you will, that the exchange didn't get a penny. It was just never explained properly or appropriately to some of the agents that were here getting certified. The only last thing I'd like to mention is we would like if you will, 3 strikes and you're out. If someone complains about an agent and it's found by the exchange to be a valid complaint, 3rd strike that an agent is brought up on, they are no longer going to represent the exchange. It hurts the exchange, it hurts the citizens of Nevada, it hurts my profession. I am a professional health insurance agent, been doing it now in my 42nd year. I'd like to think I know something about this, maybe I don't, but you know what? Even at this long in the business, I'm learning every day of the week what it is to be a health insurance agent here in Nevada. Thank you, ma'am.
And we'll be sure and get a copy of that for us. Thank you. Do we have any other public comment here? All right, hearing none, I'm going to close the meeting. Thank you very much. Welcome to all our new staff, and look forward to working with everyone tomorrow and the next day and the day after that. Thank you, everyone.
Thank you, gentlemen.